So what we have is today the demo actually consists of 2 parts. So a little bit of the history of the device, and later on I can show you how the device actually would work in practice. As you can't speak, if you have a question, you can raise your hand. There's a little reaction you can tap. And then Susie or Onno, if you can please notify me when there is a question in the chat box, so we can read it. Then I will share my screen. Please let me know if everybody can see it. Yes, perfect. Yeah. So this is the Maple device. The concept of Maple was actually thought of by a physician in the Netherlands, in the LUMC, that's a university medical hospital. And he wanted to do clinical research where he wanted to do pelvic floor measurements of individual muscles and different depths and different sides. But he couldn't find any device that allowed him to perform his research. And the research actually couldn't be performed because there was globally no device to do so. So instead of dropping his research, he requested the LUMC to actually create a device that allowed him to do his research. And the final result of that device is the Maple product. Now, if we look into why he couldn't perform his research, I think it's best to have a short recap of the actual basics of the device and what to look at EMG. What is EMG measurement? Right here. So EMG is myoelectrical activity generated by muscle fibers. And if you want to measure EMG, there are a number of things that are important. The nerve that is actually sending signals to the muscle to perform an action, the muscle composition, and the location of the electrodes on that muscle. Why? Because why is the muscle composition important? Because the myoelectrical activity travels through the muscle in the length of the muscle fibers, and this is a representation of it. So they travel in that direction between the two. And the way EMG is measured, there are 2 ways. One of them is bipolar, and this is the commonly used method of measuring EMG within the pelvic floor, and they use these type of probes. I'm sure you're familiar with them. So you have plate electrodes that run along the either side of the electrode, or you have ring electrodes that go 360 across, and you have some adaptions on those, like orbs or something else. These probes use a bipolar measuring technique, and this is a very simple representation of it. You have the black box here, and this is actually represents the muscle. Then you have the muscle fibers, which are represented by the red arrows, and then you have the 2 electrodes, electrode A, electrode B, and you actually measure the difference in signals between the 2. And the signal between the 2 electrodes is actually the EMG you're measuring. And this is called a bipolar measuring setup, because you need 2 electrodes to measure 1 EMG signal. Now, if you look at these type of probes with this type of measuring technique, and then the autonomy of the body, certainly within the pelvic floor, you see something very strange. Going back to the basic principles of EMG, the nerve that is sending the signals, the muscle composition, and the location of the electrodes on that muscle. What you see in what these type of probes are actually doing is this. The sizes of the electrodes on the probe connect with multiple muscles on multiple sides and different depths. And the ring electrodes measure 360 around, so also different depths and different muscles. So you're actually comparing 2 different muscles with one another. And you don't know where the electrodes are really placed within the pelvic floor. And this is what a very simple representation of the situation by this picture here. And what it actually is in terms of an EMG measurement, it's a non-valid measurement because it doesn't follow the basic principles of EMG measurement and how to do so with a bipolar measuring setup. And that's why the medical physician couldn't perform his clinical research, because he didn't have a clinically valid product to actually perform his research. And that's actually why Maple was developed. And this is the final product. Maple measures, we don't measure bipolar. We measure unipolar, also called monopolar, but unipolar. And we measure in a different technique. So we use a reference electrode outside of the body, placed on the hip bone, kneecap, elbow, somewhere it makes good contact with the nerve system. And we set that to measure the body's basically EMG signals as a baseline. We ground the product there, and then we have 24 individual electrodes on the probe. And when it's inserted, we have the reference electrodes for the zero potential of the body, and then the activity of each individual electrode is compared to that with the average of the total active electrodes. It's a very technical description, but what we do when we start a measurement, we first set the zero potential of the body by using the reference electrode. Then each individual electrode takes a measurement according to that. And then the baseline EMG within the pelvic floor is the average of all active electrodes of the probe. What means that is very clinical, but it means in short term that this was a concept for a valid measurement. When it was still theory, we had to prove it, that it was capable of doing so. So we actually started some clinical investigations to prove that Maple was valid, reliable, and it actually does what we say it should do. One of the studies I would like to highlight is the healthy volunteer study. It's the third one, is this one. And this study was performed before Maple was released onto the market. In total, there were 250 volunteers who participated. In the end, for only 229 volunteers, we could use the data. So 21 people didn't complete the study. They were divided into several groups. One group males, a few group females, and the males were measured anally and the females were measured vaginally, anally, or both. We had a standardized protocol how to measure each participant. We measured the EMG of each individual electrode for each patient. We did reliability testing, sorry. And we did a verification of the location of the probe within the body by placing patients under an MRI scan. And that's this picture here. So the top view, both pictures are male, front view, side view, and the bottom pictures are female, front view, side view. And here you see how when the probe is inserted, how it correlates to individual muscles and where each electrode is located within the body. In total, 24. In the end, these findings were published in the Neurology of Urodynamics in 2013, and it proved that Maple was reliable, that the system was valid, and it can no, sorry, I have a bit of a cold, so I have a speaking impediment today. Sorry about that. And it can it can identify different muscles within the pelvic floor. Then we had the following challenge, because the research was performed with a clinical prototype. And the clinical prototype had a simple line graph and then 24 individual EMG signals traveling across the line graph. But to work with that system in normal day-to-day practice is not really efficient, because you don't know which electrode is placed where according to the numbers. Thank you. Sorry about it. One of those days. So we had to create a different virtualization of the electrodes and of the EMG signals and how you view them on the screen. So we actually created a grid, and how you should interpret it is basically a tunnel view, and you look into it, and the tunnel view is created into a 2D image, and then you have 4 sides, so anterior, posterior, left, and right. And each side is then also divided into 6 individual little boxes. And each of those boxes represents an electrode on the probe. This is a short animation of how you should interpret it. So it's from superficial down to very deep within the pelvic floor. And the grid also allowed us to do something very useful. It allows us to identify different muscles and sections of the pelvic floor within the grid for very easy representation. And that's these images here. So we have identified different muscles and different sections of the pelvic floor, like the urocolic diagram and the anal canal during a vaginal measurement. And this is for an anal measurement. Because the anal, the maple probe can be used both vaginally and anally. And if you work with how you use maple then in the field is like this. So normally you don't have the representation here, but you have on the left side you have the grid, and on the right side you have the traditional line graph. And right in this picture, I think this is really where you see the added value of maple. If you look at the traditional line graph, you have here you see that there is a contraction, but you cannot see how the contraction actually takes place within the pelvic floor, which muscle contracts and how the muscle contracts, or if there's no contraction, no activity. And within the grid, you see very precise where there is activity and motor function of the pelvic floor. So here you have, if you look at this picture here, so it's an anal measurement. So this is the puborectale. Normally you would see it running from the left side all the way through to the right side here. And you see that the right side of this patient is not active. And this you can very well correlate back to the issues the patient have, and therefore very precisely make a treatment plan. And later on, very precisely electrostimulate the section as well, if that's applicable. We also have 2 different color scales in the system. The gray scale you saw earlier, this one is the absolute scale. This is specifically for that exact patient. So we set the 0 potential of the patient, then we do initial measurement. And then the white is no EMG activity and very dark is high EMG activity. Well, it should never be white, because then there's no electrical signal at all and the patient has a different kind of problem. And the color scale is a reference scale. So the healthy volunteer study, those people were divided into several groups, and if your patient can be placed into one of those groups, you can how do you say that? You can compare, thank you, you can compare the EMG data of that specific patient to the healthy volunteer study, so to a healthy pelvic floor without any pelvic floor issues. And this is a scale that can help you identify the issue for the patient. So like here, blue is less activity and red is higher activity, and white is comparable to. So what you use this for is you are looking for differences according to the healthy volunteers group. If the entire image would be blue or white or red, there's not really that much difference, because in general the patient has a higher EMG. But for this instance here, you have a blue EMG on the outside and more activity deep within, which you can then correlate back to the issues of the patient and help in your treatment assessment. That is very short the presentation I have. Before we go into the actual live demonstration where we go over the actual system and how you use it in practice, are there any questions so far?
Rachel is typing a question.
Yeah, I see it. It depends on the type of surgery. We don't know when there is additional tissue between the EMG measuring point and the actual muscle. You always notice a different measurement because there's more actual tissue the signal has to travel between. You see the same with when a female has gone through pregnancy, for example, and she gave birth. There is additional trauma to the physical trauma to the vagina and to the body. So there is in general less EMG activity because that is due to the scar tissue and the additional tissue between the actual electrode and the muscle you are trying to measure. If there are significant measurements and that are affected exactly, I don't know that. No, at least I have never come across it. Okay, then let me share my screen again, and I will share my iPad screen. Anna, before we do that, let me show you the actual system. So we have the Maple system itself. It consists of two main parts. We have the Maple docking station like this. It has a LED bar on it, and the LED bar now burns green, so it shows you that it's on. This is the Maple handheld. This is actually where all the measuring and analysis is taking place. When you put the handheld on the docking station, it charges, and the LED light starts blinking blue. When it is blue in total, not blinking, the handheld is fully charged. And when the LED is burning red, there's an issue. That's an error code to represent what it is. The handheld, very simple, only has one little button right here on the front. If I turn it on, there will be true LEDs that are started that turn on. The on light, the ES LED that will turn on when electrostimulation is on, and the EMG light. And the EMG light, let me just move this around, is the like so, will turn on when EMG is turned on, and it will also blink like it just did when it's trying to get connection with the docking station. And when it's turned off like so, it has connection. And then we also have an iPad like so, and this is where we actually control the system. So we have an application, how you read out the data and how you turn on the device for the patient. We have two cables. The probe cable, this has two different sides. So we have the side that goes straight down. That is inserted into the handheld device, like so. And we have a side that has a 90-degree angle in it. And this side is connected to the actual probe, like so. There are little markers on it, so you know which way, how to connect it. And this is how it's connected. And it should be plastic on plastic. There's a little blue rubber ring, and that should not be visible anymore, like so. And the 90-degree angle is there on purpose, so it shows you the orientation of the probe when it's inserted. So this is anterior, posterior, left and right. And the cable should always point to the navel, to the front of the patient. Then we have the reference cable, like so. This side is placed also inside the handheld device, like so. And the other side has a standardized skin-tacked electrode connection. And here you place the skin-tacked electrode to be placed on the hip bone or kneecap or elbow. Then today we have a virtual patient, just to show the function of the system. And let me connect it. And then we have the iPad application. So for that, I will be sharing my screen. I believe now it's visible for everyone, right? Correct? The iPad? Yeah. Good. So the little Maple application is here below. And I have to log in always because there's patient data in the system. So when you haven't used it for a while, it will require a password to log in. And then you will always enter in this screen. Here you have the option to either select a patient from the database, like so, or add a new patient by selecting the option here above. Now, when I select a new patient, there are a number of, there's a few things I need to enter into the system. So the name of the patient or a reference number. It depends on the reference you use in practice and how you want to reference to this patient, the date of birth, the gender, and if it's a female, if she went to menopause, if she was pregnant, and if she gave birth, and yes, how many times, the domain of the issue the patient has, and the primary indication of this patient. Now, if you go there, you have a number of domains, and for each individual domain, you have primary indications. Now, what you can also do is select the option if the patient is still under treatment, yes or no, and if it's a patient that has come by more often, you can see the history of that patient. So the measurements that have been performed in earlier sessions. Let me show you that real quick. So if we select the patient, I want to go to the patient database. I select the patient, the option left corner, top corner. Then I go into the patient database. This is a demo system, so it only has 3 patients. But if I select the Novecare patient, this is the patient card in the database. And in the history, I see that this patient came by 41 times, 41 visits. If I select that option, I go into the history menu. And here you see all the measurements that have been performed and stored. So this is on the 19th of May, I see there is a rest measurement at 11:45 for a total of 25 seconds. And the average EMG was 11.2. I can select previous or next visits at the top right corner. So if I press that, I go to the 9th of May and I did an MVC measurement, so maximum voluntary contraction. This is the 6th of May, 4th of May, you name it. Now, if it's a contraction measurement, so an MVC or an endurance, I can also go through each individual contraction by placing the arrows here. For example. And it shows the electrostimulation that was last used during this session. So this was a stimulation preset. We electrostimulated the patient for just over 1 minute with these values, a location anally at this time. Now, if we look at this MVC, I can also show it in the line graph setup. So I go to the line graph by tapping the tab right on top. If I tap here, I go to the grid. If I tap here, I go to the line graph, and it shows the measurement in the line graph setup. Now, all measurements that are in the system are of not actual patients, so the values you see on screen are not realistic. It's just to show you the function of the device. And I can, by pressing the plus and the minus, I can make it bigger or smaller to show more information. That is the history tab. Now, if we have the Novecare patient coming by today, we first want to do a EMG measurement for diagnosis or for assessment. I go to the measurement tab below, and then I go into the preset menu. or the parameters menu, I can select the location of the probe if I want to measure this patient vaginally or anally. If it was a male patient, I only have the option anally available. The type of measurement I would like to perform, so a rest measurement, MVC measurement, or an endurance measurement. I can also perform a training, but that is not stored in the history tab. Then if it's a rest measurement, I can set the total duration, so 1 minute, 2 minutes, 3 minutes, you name it. If it is an MVC or endurance measurement, so where you want to have contractions, you can select the amount of contractions you would like to perform, and then the active period and the rest period in which you would like to see the contractions. Let's do an MVC measurement with 15 contractions, the active period 6 seconds and the rest period 3 seconds. And then below that, I can set the X and Y axle of the line graph. So in this case, 20 and 30. And what I can also do is select the option for the reference lines, which I will turn on. That's this option here. On the right, you see a representation of the grid with a lot of green orbs in them, and each green orb is an active electrode. Now I can turn these off or on individually by tapping them, and then when they're off, they are turned gray. Or I can turn entire sections off, like so. And this is to really focus in on a single area. For the purpose of this demonstration, I will turn them on all together now. And then in the top right corner, I will start the measurement. And then we go into the measurement menu, like so. On the right, you have the grid. On the left, you have the grid. On the right, you have the line graph. Here you see a number of things. At the top, you see the average values. On the right, you have the color scale you're in. Here you have a button to switch color scales. So if I press the button, I go into the reference scale. And if I press it again, I go into the absolute scale. Thank you. The rain started and I'm having a cold. It's very, very good. On top of the line graph, you have 2 plus and minuses, and this is actually to set the reference lines. So if I press them, you see a red line coming into the screen. And these can be modified during measurement as well. And this can be used for a number of things. So it can be used during a biofeedback session that you say to the patient, please keep the contraction above this level, or try to have a multiple MVC measurement, try to reach this level. But it can also be used for yourself during treatment. So because now the line graph only shows 30 seconds, the original or the first contraction actually after 30 seconds is out of the image, and you can use reference lines to set the height of that contraction when it disappears from screen. Here you have the grid, and in the grid you also have a little button right here in the middle where the R and L and the little arrows. As standard, the system always shows you the grid view from a medical specialist view. So you're actually looking at the patient. If you, during a biofeedback session, want to show the patient the screen, it's the option to push this button, and then actually left becomes left and right becomes right. Because otherwise the patient cannot correlate what he sees on screen to the actual, what he's actually feeling or she's feeling. And it can be confusing. This can also be done during the session as well. At the bottom, we have the start and stop buttons, the save buttons, and the back button. So if I press the start button and my patient is connected correctly, just do that here, like so. I press the start button, and it takes a second because the system first does a number of safety checks. It sets the zero potential of the body with the reference electrode. It does the primary measurement with all active electrodes, and then it sets the average EMG signal between all electrodes, and that's what you see in the line graph. What you see in the line graph as well, the white areas are the rest periods and the gray areas are the contraction periods. Now, as this is an MVC measurement, it's the idea that the patient within that period does a MVC, so the quick maximum contraction and then let go as fast as possible, somewhere within the active period. And then tries to relax, and then again does a measurement like so. And this is of course always in terms of communication. So you, as a medical specialist, you have to tell the patient what to do. The system helps you with that as well, but that's something I cannot demonstrate, or at least I cannot demonstrate now because the iPad is connected to my laptop. Normally the system makes also audio noises. So it has a high high noise when the active period starts and a low noise, beeping noise when the rest period starts. So now you would have a low peep noise, and now normally you would have high peeping noise. Now, if I stop the measurement by pressing the stop button here, I see the average EMG signals I recorded during the measurement. They're also listed here. And I have the option to either save the measurement or throw it away. Now, if it's saved, it goes directly into the history tab you saw earlier. If I throw it away, I always get a pop-up that says, are you sure? Because there's measurement data available. Do you want to save it? Well, in this case, I do want to save it, so I press yes. And now if I go into back to the patient database, this is the Novecare patient, and I see now that instead of 41, there are 42 visits today, the 24th of May, and this is the measurement we just performed. So at 12:32, we did an MVC, and this is the overall EMG that you saw. And roughly at contraction number 4, I actually started influencing the probe, and this is then each individual contraction, and the data below the contraction is also for that specific contraction, as you see here that it changes. Now, if I do a endurance measurement, it's the same principle, except that the active and the rest periods are different, so much longer, 25 or 30 seconds. From a factory setting, the data is 30 seconds active and rest 60. If you have different requirements, both for MVC or something else or for rest, you can modify the data with plus and minuses, and you can also set them as the standard value. So if I set it to 25 seconds and I set it as default for all the next measurements you are performing with all patients, these will be the default settings for an endurance measurement. Just so. Then again, you have on the right side, you have the grid. Now, if I want to zoom in, let's say, on a specific area, let's say it's like in a demonstration, it's an anal measurement, and I want to zoom in on the puberectale, for example. Yep. Just like so. And I only want to view the puberectale, and I only want to have the actual EMG of the puberectale in my line graph. I can do that as such. So now, if I now start the measurement, within the grid, you see a lot of X's, and these are the electrodes that are not participating in the measurement, and also not in the line graph. Now, if I start the measurement again, the system does a number of safety checks. So it's set the zero potential of the body. It does the initial measurement of all EMG signals of all active electrodes, and it says the average EMG of the active electrodes. Now, if this was an actual human, and this patient has, for example, more activity on the puberectale, the line graph and the average EMG of the line graph would be much higher, because that's what we saw in the rest measurement, for example. And this is then what you would see in the line graph as well. If I stop it, I will now store it directly, and I go directly back to the settings menu. If I go now here, you see that this is an endurance measurement with the overall, and then the different. Oh, I only did one contraction, but this is the average EMG of that contraction. And of course, I also have the line graph in which I can view the endurance measurement. This is the MVC we did today, and this is the endurance we did today. We didn't perform any electrostimulation today, what you can see here. So let's do that now. Are there any questions, by the way, about the EMG measurement so far? Rachel, are you still there? Good. Okay, so no questions. Then I go on to the electrostimulation, and I go to the stimulation menu below here. So we still have the same patient, and we have the same setup as with the EMG. So on the left side you have the parameters, and on the right side you have the grid representation. The location of the last electrostimulation for this patient was anally, so the system remembers that the probe was last used anally, but you can select here the location of the probe. Because this is a returning patient, the system now says the last used settings for this patient were this during the last session, and the system records and remembers each setting that was used on each individual patient. So you don't have to write it down or store it somewhere else. The system does that for you. And then below you have the basic electrostimulation parameters that you have on all electrostimulation systems. What we do have, we also have a preset menu. If I press it, at top you see last use. This is because this is a returning patient. As a manufacturer, we have 6 different presets for underactivity, overactivity, overactive bladder, and 2 for pain. And these are settings that we advise to use and start from if you have a patient that has one of these issues. So for example, for underactivity, we advise to start with these presets. And if you have an overactive bladder, for example, we advise you to start with these, and for pain, for example, with these. We have extensive guidelines that show you how to use them and what you should do if a patient has one of these conditions. But I always say it that this is the very good starting point for that specific patient. So it's 95% there, but you can fine tune it for the specific needs of the patient as well by pressing the plus and the minuses at each preset or each parameter. You can also create your own presets, and they are stored then below here by pressing the Save As button, and then you can create a name and store the preset with the settings you have selected here. There are 4 ways to actually give electrostimulation through the body via the probe. Because we have 24 electrodes on 6 sides, in 4 sides and 6 depths, you can very precisely stimulate different areas. So what you would normally have with a bipolar probe is from ring to ring. We have that setting as well, but you have the option to select different depths for much more precise stimulation. We have side to side, like you would have with a bipolar probe. What we have is also that you can stimulate in a quarter, so more precise. And then we have side 1-1. You can select on one side, very specifically between the electrodes, or on 2 sides as well. And then you go from deep till shallow and in between. And you have side 3-3, where you select 2 plates and go from shallow to deep. And you see two colors, so the green and the blue orbs, and these are the plus and minuses. And this is just to show you how the current is flowing. The electrostimulation is biosymmetrical, so it's constantly switching between the plus and minus side for each individual electrode. So what you now see as plus becomes minus and then plus again. So it's like this. Now, if we select the settings we would like to use, you go to the top left corner to go to the stimulation to actually perform it. And then you have a very simple representation, just a line graph, a red line to show you where you are exactly. And on the left side, the right side, you have a plus and a minus to increase or decrease the current you're giving the patient. Now, if I press the start button, again, it takes a second because the system does a number of safety checks, and then you actually start the stimulation. Now, in an active period, which is represented by the blue line below, I can increase the current. And then you go into the amount of level you would like to use for this patient, and then go into the height. I'm not sure how much time now. Normally you have different polls. Let me select a different program so it's better for. No, the demonstration arrow. Right. Let me select under activity. That's a good one. Okay. I hope I don't now the system is correctly connected to the laptop, so we don't have E10. But I think this is working now fine. So if I start again, you will see it takes a second, and then the blue line appears. This is a much shorter electrostimulation period. So here you see a very good on and offset of the stimulation, and this is a rest period between stimulations. And now you see that the plus is not, I'm not able to press it, it's grayed out. And this is a safety issue, so I don't unintentionally cause pain for the patient. And now the stimulation is active, and then I can increase the current. What I can do is decrease the current during a rest period from a safety precaution. And of course, I can stop the stimulation altogether. Let us save this one, and then it's listed here in the patient history, preset under activity for 40 seconds with a highest of 15 vaginally, with this configuration of the electrodes and with this pulse frequency and duration. If I would perform multiple stimulation sessions on one day for that specific patient, I can scroll through them with the plus and the minus right here. The same goes for the MVC and the endurance. There is a little plus and minus on the right of each of these, and you can go through individual measurements there. That is in very, very quickly what the Maple system can do and how it functions. Are there any questions so far? You're welcome. Please. Not really. No, we haven't documented that. So when the probe is inserted, you can very easily just go into the measurements. There's no need for waiting. A very good question. So the system actually calibrates itself before every measurement it takes. That's part of the safety checks it does, and it's based on the number of things. So we can calibrate the system for you, but it's not a necessity from us. Maintenance, there are very little. It's basically the system is basically all software. There is, however, a battery in the handheld device. And we advise to replace that with an interval of 3 to 4 years. But that said, we also have systems in the field now that have run for they were field test units we used in 2014 when we were developing the product, and they only now have this year come back for the battery replacement. So we do advise to have the battery replaced every 3 to 4 years to keep to allow you to use the system on one charge for the entire day, including electrostimulation and all your patients. But that's something you have to decide for yourself after using it. The cables, they are parts that that have wear and tear, and they are spare parts as a replacement. No, not that we specifically advise, and that's because each patient is a little bit different. So if you have, I can have an EMG of 10 and have a perfectly functioning pelvic floor without any issues or complaints, and someone else can have an EMG of 5 and have loads of complaints. So, but we don't have that at the moment, due to that reason. Please. Yeah. So this is a question we have that we come across very often. And that's why we have also done research into this department for the size of the probe. And that's actually why we also place patients under the MRI scan. In the research that shows that the differences between the depths are very minimal, and therefore the size of the probe is functioning very well, certainly for the anal canal. There is of course the case that during a vaginal measurement, it depends on the physical trauma the patient went through, how far and how much tissue there is between the probe and the electrode. But also there, we have done extensive studies that the location of the electrode on the probe, it measures the short distance between this electrode, and if the muscle is here, you have a higher EMG readout than here, but you still measure it very well. And we can go into that in the training we are providing as well, to show you more on how to use it and what it is you see in the grid and on the line graph. We also, by the way, the normal values you determined. We don't. I want to elaborate on that we don't have anything written down for that. What we consider normal values, because each patient is different. It is a topic in our training sessions that we have experienced users of the system. They sometimes provide training. They will say to you, okay, if you have this type of readout, or if you have this level, this is then considered normal. But as a manufacturer, we have no document that states that.